So March 19th, it was the day that the kids got out of school for spring break. Shortly after school, Kennedy arrived home around 3:45 p.m. and I was in Little Rock picking up our rental car to leave for our beach trip. And when I got home, I found her in the yard and she had taken her life.
Kennedy Nida was just 16 years old when she took her life this year.
I mean, clearly the scariest moment of my entire life. She was still alive when I found her and responsive.
Kennedy was airlifted to Arkansas Children's Hospital in Little Rock, but she didn't make it.
There's the first few days after, it just doesn't seem real. Your mind and your body don't recognize that this is forever, right?
Kennedy's mother says her daughter's ongoing mental health issues seem to worsen during the pandemic.
I think things that were small and easily manageable during regular times just were amplified during COVID and isolation.
In July, Robert Redfield, the director of the CDC at the time, said suicides and drug overdoses surpassed the death rate for COVID-19 among high school students. Insurance claims for intentional self-harm among people 13 to 18 was up 90% nationally in March compared to the year before, and almost 100% in April. The CDC says from April to October of 2020, emergency room mental health visits for children 5 to 11 years old jumped 24% compared to the same period in 2019, and 31% among adolescents. Over 20% of school-aged children have experienced worsened mental or emotional health since March 2020, according to the Kaiser Family Foundation. In Arkansas, where Kennedy lived, teen deaths rose from 11 to 14.5 suicides per 100,000 teens in 2020. At Riley Hospital of Children in Indianapolis, Indiana, the number of kids hospitalized after suicide attempts nearly doubled last year. They saw a 250% year-over-year spike in October alone. 19 kids died by suicide in the Clark County School District in Nevada since the shutdowns began. The year before, there were 9. Between June and October, the school district received more than 3,000 alerts of kids having potential suicidal thoughts or mental health episodes from their writing and search activity on school-issued iPads. And Washington has seen the rate of people saying they are thinking of taking their own life increase from 1 in 10 in 2018 to 1 in 4 since the start of the pandemic. At the Seattle Children's Hospital, the director of the Psychiatric and Behavioral Medicine Unit says it's full on any given day, and the emergency department is overwhelmed with kids attempting suicide and suffering breakdowns.
Our unit has been more acute over the past year, really, than we've seen before. It's busier in the sense that when you're seeing kids who have more serious mental illness, there's more to do. And it also means more crises happen on our unit.
The hospital's psychiatric inpatient unit has 41 beds and sees 1,500 kids per year. The emergency unit has seen up to 170 patients per week for suicidal attempts and ideation since the pandemic started.
It's demoralizing to just see how serious of a problem it is right now.
Dr. Roseanne Kapana-Hodge, the founder of the Global Institute of Children's Mental Health, says school closures are seen as the most likely cause of the alarming rates.
We are social beings, number one, and the lack of social interaction for kids has been hard. That has been something that really has caused a lot of upset for kids, and some kids don't know how to socially connect unless they're in the classroom.
Children and adolescents now have higher rates of depression and anxiety because of loneliness felt from forced isolation during the pandemic, according to a recent study.
We have kids that are sad and depressed due to the long-term isolation and just difficulties and changes with academics. Then we have our externalizers. We're seeing an uptick in kids being aggressive and angry, and then everything in between. And I'm seeing that a lot, where we have kids with no history of mental health issues are really distressed.
Everyone has said that, kids can handle it. They're resilient. They've now essentially had all of these letdowns 2 years in a row because they had all of last spring and then all of this year. It builds up. Everything that has been promised to them has been taken or altered. And there comes a point where they just can't handle it anymore.
And as students are forced home and away from school, screen time is up. Kids are spending 50% more time each month on computers and phones than during each month before the pandemic, according to Super Awesome, a kids tech firm owned by video game company Epic Games. All that extra time isn't just spent on schoolwork. Kids are on social media more than ever, and some say can be detrimental to their health.
And what it's done effectively is it makes us all miserable. These platforms make us miserable. They make us depressed. But in a lot of ways, they make us depressed, but they also hit us with dopamine. I mean, when you put up a photo and you get liked, you know, it's been proven that you get a dopamine hit. And the more you get it, the more you're driven to be on the platforms. They're highly addictive.
Colton Fisher is now in college, but just a couple years ago, he was in high school battling suicidal thoughts.
And I think it's hard when you're scared and you're young because you're looking for something to help you.
He says he was hospitalized twice, one for planning to attempt suicide and another for a panic attack.
I mean, especially like being in that mental state already and then having to stay inside and I can't see my friends, like it's really hard not to be able to share that.
I think one of the things that's so hard about depression and anxiety and about thoughts of suicide is it's incredibly isolating, and people can often feel like they're the only one who feels this way.
And for the families of America's children that are no longer with us, the pain will always stay with them.
At the end of the day, there's no other ending to this story. The ending will always remain the same. There's so many people that would do anything they possibly could to help you. Like, you are not alone, and it is okay to feel this way. It's okay to not be okay.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.